Hey, welcome to the Move Better podcast. I am your host, Dr. Joe, sports chiropractor at Spine Health Functional Therapies in Daly City. And this is my host, my co-host, John Pennacerrata, the professor at SFSU in San Francisco, San Francisco State University, and owner of Network Exercise Solutions. We are here today to talk about back pain, and some of the tips that we're going to give you guys are cost of health, history of it, differences of back injuries that you might be dealing with. We're going to give you guys some information and some steps to take to get you guys better. So without further ado, let's get this going.
Let's roll.
So let's start with the history and the background, John. First, with this history, I wanted to warn you guys. If you guys are dealing with back pain, I tell you guys this all the time. I tell my patients this all the time over the phone. If you guys are dealing with back pain, seek professional help. Check somebody out that can help you. Don't just try to fix it on your own. If something more serious might have happened to you, be sure to check out a professional. And that brings us to a point that we wanted to cover today was injuries, right? I read this meme the other day that said, just because they have the title doctor in front of the name doesn't necessarily mean that they can help you. And that kind of hit home, and that brought me to this whole podcast today, right. And thinking about injuries and back pain and what people do right away or where they go to get treatment. And the first I hear is they went to their medical doctor and they were prescribed medications. We have to understand where to go when we're seeking help.
Absolutely.
Right?
Absolutely.
We need to try to figure out who are the professionals that can help me with the issues that I'm dealing with. And there's a lot. I mean, there's just so much out there, and I'm hoping that general practitioners can start, leading the way in that. And if they are reached out to, instead of prescribing some type of medication, they can reach out to local professionals that can help them. Right. Kind of on my point on that, we get all caught up in being the professional and wanting to help, and that sometimes, it might just be out of our scope. It might not be our area of expertise to be able to get that. Right?
Yeah, well, and here's one thing. As a, let's say you're a patient, you're the one that's injured, you reach out to your primary care doctor. One of the things that a lot of people, majority of people out there, think that the primary care doctor, which they should actually when they go to them, should have certain type of solutions or at least direction to where or which direction should I go with this type of pain or type of injury. But a lot of times they don't the patients don't realize that, well, sometimes these professionals may not know all the modalities that are out there, right?
Yeah.
So especially because unfortunately there's still gaps between the different practitioners, the different modalities, like I said, and how we all approach it. So you got Eastern medicine, Western medicine, you got everything in between. And if we always go to primary care, but they're not too sure of what other practices are all about, or maybe they were taught differently.
Yeah.
They may not look at those other opportunities for the patient.
Yeah.
In hopes that they should at least know about it, so that maybe they can ask, or at least have the patient go ahead and, you might take a look at that because it might work for you, right?
Yeah.
So, and the other thing is, just know for all of those people who are listening today, remember, practitioners, this is their practice. Everybody practices differently. So one may come up with a different solution over the other.
Different philosophies.
And most of these things that we deal with should be individualized.
Absolutely.
Right?
Absolutely.
So one doctor may say one thing. That's why we always say get another opinion if you're not too sure what they just told you, right?
Yeah.
And so from our perspective, we do tend to go with more on the holistic side, as well as we like using, movement as a way for our tool for medicine, right?
Yeah. Movement is medicine, right?
Yeah,
exactly. So, back pain, the history behind it, right? It's the number one cost of injury, and in life, almost every single person, I think that the stat is like 90% of the people in the world will experience some type of back pain in life.
Yeah.
Right. And 85% of that back pain, I was just reading a stat on that, 85% of that are of unknown etiology, right? Etiology, is that right?
Etiology, yeah.
Etiology. So we can't really, whether we try to figure that out, why do we not know what kind of back pain that is? And that goes along with this point is a lot of them, it might just be poor diagnosis, right?
Yep.
Hey, you're dealing with back pain? All right, let's go ahead and let's get an imaging done. And a lot of people that are out there, they don't realize that imaging doesn't tell the biggest picture of everything.
Right.
It may give us an idea of what's going on inside the car,
Sure.
but even if people who've had car troubles in the past, when you look under the hood and you look there and you're like, well, what the hell am I looking at, right? Like, that doesn't mean anything to us, right? We need to figure out the cause of that back pain and as number one.
Right.
And so understanding that 85% of those back problems are unknown,
Right.
are of unknown reason, honestly, I think that's brought up to poor diagnosis, right? And again, when we talked about each profession will give you a different view or philosophy that they're presenting to you, right? Like a surgeon, a surgeon, they'll look at it like, hey, we've got to do, and I'll take that as a grain of salt, because there's a lot of people that come into me today and they're telling me that surgeons are like, no, try something else first before we go into
surgery.
it. But if you're a new surgeon, and remind you guys, the medical business, the holistic, we're all in a business here.
Yes.
And if you're a new surgeon and you're trying to get your feet wet and you're trying to get work done, you're going to say surgery.
Right.
Am I right?
Well, yes, because as a surgeon, what did I train to do?
Exactly.
My training was surgery. Mm-hmm. My training is not, we're going to do, these exercise therapy for you.
Yeah.
My expertise is surgery. So by the time you talk to me,
Yep.
and because this is what I do,
Yeah.
I'm already going to lead you towards this direction, right?
Yeah.
But like you said, there are some surgeons out there now that I should be your last resort.
Yeah.
Which is, I believe that should be the case, right?
Yeah.
We had a recent patient slash client that was, she actually just got through her surgery. Mm-hmm. But if you remember, she was really exhausting everything that she could, to the point that she finally was like, you know what, I'm just in too much pain.
Yeah.
Right. So I was like, okay, if that's the route that you feel like you need to go, and you feel like you've done enough of your research and understanding who you've been talking to and tried all these different ways of trying to relieve this pain, then that's fine.
Yeah.
But just understand what comes after surgery too.
Yeah. Yeah.
So which is basically you're gonna come back and go to some more therapy.
I think the hardest, that's true though. You got to go through therapy at one point, but I think that's true for all of our expertise, or all of our professions.
Yeah.
Is when do we know when to stop? I had a patient recently, and I'm pretty cocky when it comes to helping people. I feel like I can help a lot of people.
It's called confidence.
Confidence. I'm pretty
bro,
confident
not cocky, confidence.
In the things that I can do. And I had a patient that was coming in to me for 3 weeks, and we've been seeing very, very slow progress. And I simply said to her, like, hey, I'm not sure if we're plateauing, or, based off of the exams and the assessments that I've done, we're kind of slowing down a little bit. I want to know, I can't put this all on her and say, are you doing your exercises? Which she wasn't.
Yeah.
But that's part of it. But at the same time, I'm the professional. I'm supposed to be the one to help her out.
Sure.
And so at that point, I was like, all right, maybe it's time that we move to another route, right? Move to a different place. So I referred her to a physical therapist. Yeah. And the physical therapist is taking it on as well, but they have different eyes on this, right? Mm-hmm. And more than anything, I want to see that person get better, right? And if I see that person get better, I honestly feel that I've achieved something along those lines as well. Mm-hmm. Whether I got her to a point where she was out of pain, her movement-wise, I couldn't get her to a certain point.
Right.
But I was hoping the physical therapist was going to do that. But if they can do that, geez, I mean, that's exactly what I want to see, right? That's what I think every professional wants to see. Is
100%.
Their patients actually get better.
Right. I mean, there's obviously the thought of, like you said earlier, the business aspect. But, we all come to this industries in hopes that we can help people as much as possible, right? Get out of pain, get better wellness, so forth and so on. And I think for us, as we get through our, as we work into our industries for, we've been in this, like we mentioned before, more than 2 decades plus, right? There's a point where we really have to say, okay, if I'm not able to help you, who can I refer you to, right? And we're hoping that's what everybody's doing, right?
Yeah.
Because a lot of cases that's not the case, because they just want, again, the business aspect. But if that's, if that's the way we can all operate, then I think it would be better for all the patients and consumers out there as far as getting the right help for the pain that they're receiving.
Exactly. And we've got to remember like the education behind it, right? Like what are, not just for the practitioner and what they know, but being able to teach the patient what back pain is all about, right? I think that we do get caught up in advanced imaging too much when we know that there's studies out there that show that people have, we don't know the differences between an inflamed disc versus a disc that's chronic and that's been there, right? It doesn't really show up on an MRI, right? We have, there was a study recently that's checked on, I think 800 hospital workers.
Okay.
They found that each one had a disc problem.
Wow.
And I think 10% were, 10 to 20% were actually feeling the effects of that herniation, right? So
wait, only 20% was feeling it.
only 20% actually felt
like,
pain,
like there were
injuries,
symptoms.
There were
Okay,
symptoms,
gotcha,
exactly.
gotcha.
So, we see those things, and I think it's our duty to be able to explain what a disc herniation can be, right? We get caught up too much in saying that the problem is a disc. That's the diagnosis. The person has a herniated disc and has radiculopathy and so on and so forth, like radiating symptoms, ridiculousness, right? And so when they have these injuries, like what do we do about it, right? Is the only chance surgery? Because I hear it a lot. Hey, we want to make sure that this spinal fusion is going to help that disc injury so it doesn't herniate even further.
That's actually interesting you said that, because I don't know if you remember, like several years ago, I was diagnosed with rectal listhesis.
Yeah.
And so, imaging. It was X-rays.
Yeah.
All it was X-rays. And so, my primary comes back to me and says, "You have rectal listhesis, but when you extend your spine, it decompresses."
Yeah.
It's like, oh, okay, cool.
I remember you saying that to me,
right.
yeah, and I was like, oh, cool. You have rectal listhesis.
Right. And I go to him. So I said, what should I do? He goes, I don't know. You probably know better than I do.
That's what he said to you?
I said, so you're not going to refer me to a physical therapist? He goes, well, don't you know what to do? Like with exercise? I go, yeah, but sometimes I need help too.
Yeah, it's the hardest treating yourself.
Oh, yeah, absolutely.
That's the biggest thing. Like I've dealt with back pain for a long time. And treating myself and trying to find the cause. Yeah, I had a disc injury. I've seen my lower back in imaging and stuff, but none of that helped me.
Right.
None of that helped me.
Right.
I went to chiropractors, physical therapists. I went to multiple professionals in the field, in the health field, and nobody could help me.
Yeah.
And that was one of the reasons why I became a chiropractor, was because I wanted to try to figure out how to fix myself for one. And no matter the amount of adjustments that I got for myself, no matter the amount of exercises that I worked, or core exercises that I worked, it didn't help. And I had to figure out where it was. And once I started taking classes with like the SFMA, listening to Gray Cook, Kohler, McGill. McGill is one of the guys, one of the pioneers in back research. And once I started reading up on all of that, I figured it out, right? And I was like, oh, okay, now putting all of these expertise together. is what actually helped me. And it took me a while. Right. And if I could just have that one person to bring it all for me together, bring it all together for me, that's all I needed.
Yeah.
But there wasn't anybody around. It was just the simple response was, stop working out.
Right.
Stop lifting much back. Yeah.
Right.
I love squatting. I love deadlifting. I loved Olympic lifting.
All of a sudden you can't do that anymore.
I can't do that anymore.
What?
And so those are the things. It's like Jackie, my wife, she was 20. I think she was 22 when the doctor told her to stop running because she's going to break down her knees. And then I heard a nurse, one of my patients who's a nurse, that just came up to me, and she's like, and she's a nurse at Stanford, and she said, yeah, every doctor that I went to told me to stop running because it's going to break me down. And I go, how old are you?
Yeah.
And she's like 33. And I go, wow. Are you serious right
Yeah.
now? No, you should be able to do all of this stuff. But that brings me into the point of finding the right person for you, right? Finding the right person that's going to be able to help you. And there's different doctors out there. There's even different chiropractors and physical therapists out there that focus on various things. Like, you know, if
specialties.
like athletic, like I just said sports chiropractor. Like, what does it mean to have a sports chiropractic office, right? And in our case, our main focus is the fitness athlete, right? The fitness patient, right? And people that are working with CrossFit, working out with CrossFit, Orange Theory, high intensity, base camp, boxing, kickbox, whatever it is. We have to know how the person is moving in order to properly diagnose that person and what kind of injury that they had. Because the treatment is going to be completely different from a person that plays baseball, football, or even a weightlifting athlete.
Right.
And it's fairly new these days to work with the fitness athlete, right? Like the Olympic lifter, and finding out how to get them back. And that's the reason why I'm seeing a lot, and which is great. I'm seeing a lot of posts now that are saying like, hey, manage your pain better.
Yep.
Figure out how to manage your pain, and people walk them through certain things. And what, we're supposed to mobilize our spine. We're supposed to take it through range of motion. But how do we fix that after an acute injury? And that's one of the main topics that we're going to go through today, because there's a huge world out there with back pain.
You hit the point though, right? So even for yourself, and I've been doing the same thing of like trying to figure out different multidisciplinary approaches. And I'm glad that, obviously from the practice at SHFT here, that's the approach. That's why we have, different eyes and ears of different approaches in treating a patient. And so for all the audience out there, that's something that they should consider, is what are the different disciplines out there that can help them instead of just one way, right?
Yeah.
Because we're still all learning.
Exactly.
We're still all learning.
And it's different all the time.
All the time.
And that's one of the cool things about this office here. Is sometimes I'll be working with a patient, or I'll have another doctor working with a patient, and they'll bring in other eyes. Yeah. And sometimes, which one of the coolest things I've seen is, we'll have like 2 or 3 practitioners standing over and helping out a patient and trying to figure out, like, it could be this, it could be this. Where have we been going wrong on things? And just to have that different approach and an open-minded approach to helping get the person better is the overall goal that we need to get. We need to get to. And
and honestly, we gotta just, for some of us, we might have some ego because, hey, someone else has had a better answer than you, a solution, right?
Ego.
And we got to put it to the side and say, okay, hey, I'm glad that this person was actually able to help this patient versus, I was trying and trying, but it wasn't working out.
Exactly. Exactly. So a multidisciplinary approach is definitely a route and that's one of the reasons why SHFT is here, Spine Health Functional Therapies is here, is because we are utilizing many different minds and putting that all together and where they've all came from. We have ATCs, massage therapists, neuromuscular therapists, chiropractors, and we're all coming together and trying to figure this all out. We even have, friends that are PTs and working with network exercise solutions as well. And, all of us have a little bit different input on it. Acupuncture, right? Dr. Cookie, Dr. Elaine, she helps us out as well. And these are all good things to put together in order to get somebody ultimately better. What are the type of injuries that are out there? So again, we're going to be focusing on acute low back pain. And what acute low back pain is, something that is very fresh, very new, within hours, minutes. There's a wide range of back pain out there, types of injuries that we deal with, but we're trying to help you guys. We're trying to help the person that is that has no idea how to fix that or doesn't really move that much.
For those that don't know what that is when you go,
like you,
you just all of a sudden
like, there's a Lego on the ground. You're like, oh my God, what's that pain?
Dude, the first time I ever felt it was I was in my early 20s.
Oh yeah.
I was putting my sweatpants on, one leg at a time. I'm balancing myself, and I put it on, and I locked.
Yeah.
And I couldn't move. I slowly stood up and I was like, oh shoot,
Yeah.
I really couldn't move. And funny thing was, I had, I was like, I was 22. I had swimming class, so I said, I'm gonna go to swimming class anyway and just
push through it
and work it out and see how it goes.
Yeah.
Man, I don't know if that was the best idea because I was pretty much on the floor the rest of the day after that swimming class.
That being on the floor. Like, how many of you guys have been on the floor? Like, just got knocked out by this thing, and you know, I've had people call me and like, hey, I can't move. I can't even get into the car.
Yeah.
How can I fix this stuff?
That's
that happened to me.
acute
That's
pain right
exactly what happened to me.
Yeah.
I didn't know what to do.
I remember
with it.
Chicago.
Oh, Chicago always.
Yeah.
So out here, one of the big things that happened to me was it was early in the morning, not even warmed up yet. Not even warmed up. Like, who warms up like to get their day ready, right? But I got up, and I'm like 22, 23 at the time. And the first thing I do is I see my roommate. He's out he's out across the street, and he's warming up his car, and I plan on scaring the shit out of him. And so I start running.
Like you always do.
And I'm like, like I just did to you today.
Yeah.
I run over to his car, and I'm like creeping. And right when I see him roll down his window, and right when I jump out at him, my back goes boom. And I felt like that lady in what is it, Billy Madison, where he goes, "Get me out of here," where she was on the window. I fell on top of his window, and it knocked the wind out of me. And I was on the ground, and I was like, and he goes, "I saw you, dipshit." And then I literally fell to the ground.
Yeah.
And I crawled, and I remember crawling across the street back to my garage.
You crawling?
I'm crawling, and I'm like trying to breathe because it hurt so bad.
Yeah.
And he gets out of his car, and he walks over, and I finally get into the garage, and he's seen me crawl there, and he goes, "Are you okay?" Like, he goes, "If you're still in this garage by the time I come home," he goes, "I'm gonna feel really bad." And I'm like, just go, just leave. I think I was on the ground for almost 13, 14 hours.
Oh man!
I stayed on the ground. I had no idea what to do.
Right.
The first thing that people told me in the past was, stretch it out. It's a spasm. It's a muscle spasm. It's an injury. So I grabbed my foam roller, and it was in the garage. Luckily, I had nothing else in there, and I grabbed the foam roller and I put it on my back, and holy shit, worst spasm of my life. And I just fell, and nobody got to me about 4 hours later. My brother opened the garage door up, and he goes,
He's just laying there.
He goes, "What is wrong with you?" And I go, "My back hurts. I can't move. I don't know what to do."
Yeah.
Long story short, I'm there. They had to grab a towel. They had to pick me up, and I laid on the floor for about 3 to 4 days, not knowing what to do. I had to crawl to the bathroom to go to the bathroom.
Oh man!
I had to crawl
that
myself up to the
sucks.
toilet, and it was the worst.
Yeah.
And at that point, I used to get back spasms and injuries once every month.
Yeah.
And that's draining on you, right? That changes your mood, that changes your attitude.
Right.
So what kind of back pains are there, right? We have things that are insidious, things that we don't know where it really came from. You woke up with some back pain, right? Overuse injuries, right? Yeah, and then overuse injuries, strain, sprain, muscular, muscle spasms.
Yeah.
We say discogenic. Could it be a herniated disc?
Yeah.
Well, we don't know.
Yeah.
Right. And that's why we need to get the whole picture of everything, right? Of how you actually got injured.
Right.
But there are definitely some things that you can do in order to fix yourself, and we'll be going over that a little bit later. But today, again, we're going to be going more through the, what do you do right away, right? What are the first things you do? And I'm going to tell you guys right now, stop stretching it. Stop stretching.
What?
Stop foam rolling.
What?
Yeah, right? Exactly. That's exactly. I hear it all the time. They're like, first thing I have with a patient that comes in is they'll go, "Oh, I hurt my back a few days ago. I couldn't get out of my bed, and blah blah blah." And I go, "What did you guys do for it?" I'm like, "Well, I started rolling out." Because with a muscle spasm, and there's a lot of massage therapists that don't know this either. With a muscle spasm, what's the first thing that people do? They'll go right into trying to massage it out because that muscle is so tense that it's so enticing to go to it to try to find a way to release it. But that muscle spasm's happening for a reason.
Yep.
And it's trying to do something.
That's exactly what it is. See, people don't understand that it's actually a protective reaction.
Yeah.
Right?
Absolutely.
And if, for those of you watching, if you think about it, the muscle body part is trying to protect the area. And now you're trying to force it to unlock.
Yeah.
And that's why it's painful.
It creates
when you're trying to release it.
Yeah.
Because it's telling you, no.
Yeah.
You're not trying to release me right now because I'm trying to protect your body.
Exactly.
Right?
Exactly. In McGill's research, he says it creates a false sense of security.
Yes, yes.
Right? And that false sense of security
There's an analogy
makes it worse.
that I learned. It was like, imagine that door is locked and you're trying to get in and you're just trying to bust through versus just have somebody on the other side unlock it for you.
Yeah.
Right? So it's actually like trying to find out how to unlock it from the outside, from the inside versus you trying to bust in. So that busting in is the whole like, I'm just rolling this out right now.
Yeah.
Right? Which is harder. It's painful.
Yeah.
You know, they wonder why, okay, wait, it's supposed to be painful. Well, to a certain degree, I don't know if you want to be in that pain when you roll out.
Yeah. Exactly. And you don't want to roll it out. Like a lot of people feel like they need to go into pain in order to feel better.
Right.
That's not necessarily true.
Right,
and how that affects the brain. And, there's a lot of brain research out there, a lot of functional neurology out there nowadays, and research that is studying chronic pain syndromes and injuries and how pain affects the brain and creates an atrophy and changes mood and changes your lifestyle. Because I've had people in here with chronic pain just from a small low back injury. Nobody's been able to fix it for them.
Right.
And it turns into this chronic thing that they just go, oh, I'm used to it now. I'm dealing with this pain. And in actuality, it's going to make it worse and worse and worse. Right. Your brain is so powerful, it has the ability to shut that off.
Absolutely.
Shut off all those signals, shut down those signals. However, the signals don't stop.
Right.
Right? And that's the reason why sometimes I may press on your shoulder or press on your back, and all of a sudden you go, oh, that shit hurts. Like, what is that from? Right? It creates a hypersensitivity. There's neuroplasticity that starts to happen. And there's some negative effects that happen over time with you just not fixing the
actual
issue,
cause,
right? And just waiting for it to go away.
Right.
And that's one of the things that reaching out to a professional that knows about back pain, right? Not just going to anybody out there. It's the more you know about how to fix it, the faster you can get pain away, right? And not only, and pain is a very small marker for us. It's finding out what the injury was in the first place that caused that pain. Right. So, number one of the tips to understand number one is, first, don't roll.
Stretch it, right?
Don't stretch it.
Yeah.
Don't roll it. Don't massage it. Find a way to stabilize the injury.
Right.
And that's something that McGill teaches us in a lot of his studies. And DNS, Kohler, and trying to figure out how to stabilize the core. And I'm not saying planks right away.
No.
But you're trying to protect the spine. And that's what I mean by stabilization, is knowing the mechanics of the spine is of high importance, right? And in this case, for all of our viewers out there, is just protect the spine, and meaning flex your abs, try not to overly walk right away, lay down on the ground if you can, and just start utilizing your core muscles, right? And in a way that breathing is activating your core muscles. A simple drawing in maneuver of your belly button is activating core muscles, right? Lifting your hands over your head is a core muscle, is utilizing your core muscles. Moving your hands, a lot of people don't realize moving your hands can actually start activating the small stabilizer muscles of your spine. Same thing with your feet and your legs, which is one of the reasons why we do bird dog exercises. And again, we're going to go over some of these exercises in a little bit, but trying to maintain what we call a neutral spine and trying to protect that as much as possible is the first step, right? Don't foam roll, don't stretch, protect your spine, work on breathing, stabilization. Don't try to get up too fast. Don't try to move around too fast. Don't try to stretch. That's not the route.
It's funny, when people say core, right? Because you mentioned that, and the first thing that comes to mind is the abdominal region, right? Abs, which is just a small part of it. So for those of you that are not too sure what that is, when people say core exercises, they think planks or maybe some crunches and stuff. Right? But there's much more to that than what most people know.
Absolutely, and I think that's really bad advice for back pain, right? And and I 100% believe that, right?
We're gonna get people be like, "What?
Like,
What are y'all talking about?"
Just strengthen your core.
Yep.
Right. That's you hear that shit all the time. When in actuality, your core, like when I say strengthen your core, the first thing we think about are plank exercises, crunches, sit-ups.
Yep.
Those are just bad things. In actuality, crunches can actually make the spine worse. Right? And bend your knees when you crunch, right? When you do all these crunches and repetitive motions, that can lead to overuse injuries. Repetitive stress along the spine, because when you bend your knees, you're not creating a neutral spine for that lower back, and you're pressing into it as you crunch up, so that lower back starts to round out.
Right.
And I get this all the time. Like, I deal with fitness athletes, and they see things on Instagram on, you're supposed to mobilize your spine. You're supposed to move it, and the butt wink, right? Some people talk about the butt wink, and what if you don't know what that is when you're squatting down, and at the base of your squat, you start to see your butt kind of curl underneath you, which is a normal
natural movement. Yeah.
But when it's a loaded position, that's when we start to have some problems.
It could be a problem.
Because we start to put pressure and stress along the capsules and ligamentous structures of the spine, which can create those disc herniations, which can create those injuries. And our body, unless we're prepared for it, unless we've trained for it over and over and over again, 90% of the people are not that way, right? And they're going to the gym, they see these people working out, and they're like, I got to do this squat.
Well, yeah, what they don't realize, right? You got that lower back arch like this, and then you start doing crunches.
Yeah.
So that lower back actually starts flattening out like that.
It starts flattening out,
right?
yeah.
And you do that more often enough, those muscles, like a rubber band, starts getting tighter.
Yeah.
And guess what happens to your lower back? It starts flattening out.
It starts
which is not your neutral spine.
Exactly.
So
exactly.
Stop it, guys.
Same thing with the squats. What other bad advice is out there for back pain?
Oh man.
What do you think?
A lot of it is, stop moving.
Yeah, right away.
Right?
That's
Don't
the
move.
first thing. Don't move.
Don't
Stop
move.
moving.
I get it, right? Because you want to maybe alleviate the pain, which is, something that we all will say, okay, we got to alleviate the pain a little bit. But to what degree?
Yeah.
Right? To what degree do you stop moving?
Yeah.
Because some people will take this into like too far.
Yeah.
Right? Next thing you know, hey, I haven't moved in like 3 months.
Oh my God. And you hear that all the time.
I injured myself. Okay, cool. And what'd you do? I stopped moving.
Yeah.
How do you feel right now?
Yeah.
I don't feel that good.
Yeah. You've got to move to tolerance. You've got to move to tolerance.
Yeah.
You've got to be able to continue to move. For one, that helps the healing process.
Yes.
It doesn't create inflammation that's stagnant.
Yes.
Stagnant inflammation is a bad thing, right? It creates hypoxia and suffocation of nerve of cells, of blood cells and nerve cells, and creates more pain later on. Excuse me. So yeah, you've got to be able to move the blood flow around. You've got to. What I said before in a recent podcast was moving inflammation or controlling inflammation, not necessarily stopping the healing process. You need it, but you also need to keep moving.
Right.
And so, you need, like titas.
Yeah. I was gonna say, interestingly enough, right? So, we're Filipino, and in our community, especially the elders, right? First and foremost, although we have this profession that we do, a lot of times the older family members may still not listen to us, right?
Oh, absolutely.
That's fine. That's how it is sometimes. But there's a big belief in the older generation, and it's getting passed down still to the younger generation, that they need to stop moving, or they can't, or because I'm getting old, I can't do this anymore, or I shouldn't do this anymore.
Yeah.
I hear some of my other friends say.
Oh man.
And I deal with it with my own father and my mother, actually, where it's harder and harder for them to move.
Yeah.
And I'm in this position where, like, oh man, I gotta help you out somehow, but they have to have it inside them too, right, to want to do it. But at the same token, I could tell that whatever the root learning situation it was for them, it was it was basically leading to like, okay, if I'm hurt, I'm no longer going to do this. I'm going to stop moving.
Yeah. Yeah.
Totally, right? And I've seen our elders just regress and get worse and worse and worse as they get older. And I try to inspire them because we have patients and clients that are in their 70s and 80s.
Yep.
And I'm like, look what they're doing.
Yeah.
They're not walking around a cane.
Yeah.
I had a 83-year-old client who we were working with her virtually.
Yeah.
Right? God bless her, man. She was like ecstatic the other day. She was she's a librarian, and she works at the school where she's at the children are grade school, and she had to use the bathroom, and the adult restroom is upstairs.
Yeah.
But she had to go.
Yeah.
So she went to the kids, and without her even thinking about it, she squatted down, used the toilet, and the toilet is for kids.
Shorter, yeah.
And she's like, and it gets up and was like, wait a minute, I didn't even have to hold on to anything.
I just did the perfect squat.
Right. She didn't have to hold on to anything.
Yeah.
She went down, boom, boom, did her thing, got up, was like, holy shit, right?
Yeah.
Calls one of my, my sister, because I know her from my sister.
Yeah.
Calls my sister, hey, you need to tell John. I just used the toilet without using anything to hold on, right? And I was like, man, God bless you, right?
Cool,
God bless you, and that's the thing. And I think that's very important for us to realize, and it hits home for me because of my parents. Is that it's hard to get them to change their thought.
Yeah.
All you can do is
because they're so driven,
right?
Yeah.
It's just to help them, just like, okay, let's just try this and see how it goes. And at the end of the day, they're gonna want to have to do it. But that's why we have to be patient enough to be like, all right. Because the thing is, I could sit here and it's like, oh man, I'm helping other people. I can help my own parents.
Yeah,
right?
Absolutely. It's hard, man.
And it's tough,
especially when it's your own family members. I think that's the toughest thing. But
and so the community out there, I mean, if you guys are listening, don't tell your parents to stop moving.
Yeah,
they got to keep moving. I get it. My dad fell the other day.
Yeah.
Right, and I feel a little guilty because I was making a move.
Yeah.
Right, and that's part of it. But it's worse off that they're not moving.
Yeah.
Right. There's another analogy that I was thinking about was you have children, right? But with you, it's great because you're letting your girls just go run around, do your thing.
Yeah.
How often have you heard other people say, "Stop moving," to the kids?
Oh yeah.
Sit down.
Yeah.
Right.
Yeah.
Or even our maybe our parents, they were our aunties, right? Our titas, and they would say, "Stop moving." That creates a little bit of a seed in their head that as they get older, I'm gonna stop moving.
Sit down.
Yeah, I'm gonna stop moving.
Oh gosh, I got that all.
And how many people do we know that don't move anymore?
Yeah.
I mean, we're still young.
Yeah.
I got friends and peers that just doesn't want to exercise. They just don't want to exercise.
Yeah. Yeah.
So
putting your kids out there. I mean, starting with it does teaching them from a young age to keep moving.
Yeah.
Right. Like my girls, whenever we're stuck at home, it bothers the hell out of me. So one of the things when I was growing up was I was out all the time. Right.
Yeah.
My brothers would never let me play Nintendo because I sucked at it, so I was never allowed.
Yeah.
I was never allowed to play with the electronics. So I had nothing else to do but play sports, right?
Yeah.
Which kind of leads into where I was. I was the athlete. I was one playing more sports than anything else, right? So, but it does start at an early age. But growing up, I hear it all the time, right? My parents, and I even hear some aunties and uncles coming in here and saying like, "Oh no, I'm too old for that."
Yeah, right.
I'm too old.
Oh my God.
Move like weightlift. Like what do you mean
come
weightlift?
on, let's go.
Right. I have a patient right now, and of course we're not using names, right? But we have a patient right now where like she's like, when is my neck gonna get better? I'm like, well, we want to teach you exercises. It's not gonna get better by us just doing these manual therapies, although it can.
Yeah.
We need to get you exercise. She's like, exercise? And she's
100%.
She's
Oh my God.
Also.
Yeah,
she's just looking, and I remember her. We put her out on the floor, and her face was just, oh my gosh, like why do I have to do this?
Yeah, they want that magic pill, bro.
Yeah, and movement is definitely key. We need to keep moving. We need to keep strengthening, exercising these muscles in order for otherwise, that term you don't use it, or you use it.
Use it or lose it.
Use it or lose it. There it is.
Yo, my ex-phys professor, that's the first thing he told us. You know, God
yeah.
bless him. I don't know if he's still alive, but
Yeah, use it or lose it.
use it or lose it.
Right.
And
So
it applies.
yeah. Another. What other bad information?
Well, we did the whole
Posture.
about posture.
Posture.
Yeah,
That's one thing. So one of the things that I get a lot was.
Oh wait, when you say posture, people start doing this.
Yeah, they start sitting.
All right. I see people here started doing it. See Mike over here did it.
He starts sitting up. Posture is more than just sitting up straight, like you have a stick up your ass. Aaron Alexander, hey, he's the one that quoted that, but it's the truth. And when I heard that, I was like, yes. You know, I get all the time, like I'll have patients that come in here, and you know, in chiropractic school, we were taught a lot about posture. We were taught a lot about movement and checking how we were going to adjust people, and we checked leg length deficiencies, right? And how your body is adapting to the environment. And I get that, right? But the way it's delivered to the patient and where they have the problem is they'll come into my office and they'll go, oh, I already know why I have a back problem.
It's my posture.
No, I have my posture, but my feet are on level.
Oh, yeah.
I have a leg length deficiency, or I have my hips are off.
Right.
And so that's the reason why my back problem is happening. That's not the reason why you guys have back problems, people. It's not the reason why. There's a certain adaptation that you guys get to an environment, and you guys have lived that way your whole life, and that's totally cool.
Movement patterns, baby.
Movement patterns. You have these movement patterns, but you have deficiencies in these movement patterns. And if you're not prepared for a specific movement, that's where the misfiring or the misconnection might happen, and we can't predict those injuries. We can't just say, oh my gosh, your hips are all off, so that's the reason why you have back problems.
And the thing is, when you say posture, people don't realize, like, your posture changes all the time.
Exactly.
And you can't just say, oh, I have good posture because you're sitting up like this the whole time.
Yeah.
Well, guess what this will do? Now you're stiff like you're walking like this, and you're moving this way. Now that's going to create a movement pattern that is going to be deficient on something else, right?
Yeah.
So
that's that, and posture, and you know, other things, sleeping patterns. Bed. Your bed is not the reason why you guys are
it's not. Damn, I was gonna spend hella money on
no,
your bed.
that's I hear that shit all the time. Get a sleep number bed. Get a Posturepedic. You know, get.
All right, sleep on the floor.
Get something that you got that works for you guys, right?
Yeah.
You know, one of the things that's eye-opening for me is going into the third world countries and seeing this, right? And they don't have those fucking luxuries.
No.
They don't complain about back pain.
Nope.
None of them are talking about that shit.
Hell no.
Remember this, guys. Like, yes, we have a lot of technology out here for us for cervical pillows and neck
business,
pillows.
bro. Business.
It's business. Find the bed that what kind of bed has always worked for you guys, right? What sleeping pattern? You know, people are like, oh, you've got to get all these pillows and you got to surround yourself and make sure you don't move. You move once every like hour in bed, and if you're holding yourself in one position, guarantee you are not going to sleep well.
Oh no.
You are going to get way less sleep than you are if you had. If you were a lot more free. You've got to find out what bed works for you or what's always worked for you, right? What pillow has always worked for you. I sleep on flat fucking pillows all the time. And my wife always says, do you want a little bit more of a fluffier pillow? I'm like, no, I like how flat it is. I like putting my shoulder underneath there. I sleep a little off.
What's funny is, right, some of these pillows are pretty big. You put it right here and you're sleeping like this the whole time, right? Right?
Yeah.
I had a client one time go, hey, let's take that pillow off. I had him do stuff on the floor. I said, all right, I need you to lay down. He had to forcefully do this to have his head lay on the floor.
Jesus, yeah.
I'm like, so how are you supposed to do your exercise, man? You got a pillow? He goes, yeah. How big is it? It's pretty big. I was like, okay, that's probably what it is. You know what I mean?
So, I mean, it could be a part of the equation.
Yeah.
It's just not every reason why. Right? It's your desk. You're sitting at your desk. The problem with posture is you're probably in one position
too stagnant,
too long,
right?
And you've got to move. You've got to get there.
Let's get a standing desk.
Yes,
and then what they do?
It's not a seated or standing. Yeah, it's not a seating or it's not a sitting or standing problem. It's a movement problem.
It's a movement problem or lack of.
And one of the things that I tell my patients all the time is the more you move, the less you're gonna worry about your sleeping posture.
Right.
The less you're gonna be worried about your your bed at night or how you're sleeping or putting a pillow between your knees. Just, stop with that.
What about stretching more though?
Oh, stretching.
How about, well, you said earlier, we're like, well, you start stretching it right when you get that acute pain. Well, when do we actually stretch, or do we need to stretch more even after?
So here's a misconception about stretching. If you stretch once, twice, guess what's going to happen? It's going to go right back to normal, right? People, and one of the things that is a misconception too is stretching is yoga. Stretching is not yoga. Yoga, there's a lot that goes into it.
Oh, absolutely.
Right? There's a stability, there's mobility. You're controlling the difference between stretching or flexibility and mobility.
Yeah.
Is control.
Yes.
Right. So
yoga is all control.
There's
man.
a lot of control with yoga,
control.
and that's why I love yoga. It's an amazing exercise, amazing work, but it's not just stretching.
Yeah.
Right. Yeah. You got to reach down. You got to touch your toes. You got to do all these things, but stretching more is not the answer. It's controlling your movement, right? Stretching may be a part of the equation to get you better. However, it's not the best advice to say, all right, in order for me to not have back pain, I just need to stretch more. You're going to be stretching forever and you're not going to get anywhere.
Right.
So just remember that stretching is a very, very much a part of the equation.
Yeah.
And in our programs, we talk about stretching for less than 10 minutes, right? And that includes the foam rolling aspect of it. We've got to train our mobility more.
Yes.
Right? And we've got to train that from a non-loaded position with weights, resistance. And we've got to train that with loaded, right? We've got to be able to train that with weights,
Both.
with resistance,
Yeah,
right? So we've got to train
with,
a variety of different ways. And it has to be consistent, right? Because that's the only way that your body is going to adapt.
Now you're creating new patterns of movement.
Exactly.
Right?
You've got to get your body to adapt to that.
Yes.
Right. So, again, common mistakes to treating low back pain are, stretching, foam rolling the area of injuries.
Yeah. Getting that release right away.
One of the things that to fix that is work on trying to stabilize it, right? Decompression, working on activation of the muscles rather than stretching and trying to turn off the muscles. Give it what it's asking for.
Yeah.
If it's asking to flex your abs more, sometimes it might just need flexing your abs more, right? If it needs a way if your back is the one that's spasming and is trying to pull you a certain way, it might need that. But we're going to give you guys some tips and tools that can help you guys immediately, so that way you guys can at least start moving.
Yeah, you're not stuck in the garage for 14 hours.
Exactly. Treating.
On the floor.
Exactly. Don't be like me. We've got to be able to retrain it, right? Ice, heat, right? Oh, that was another one that we never really touched upon.
Yeah, we didn't talk about icing and heating.
Was one of the reasons why people do icing is, that can actually help decrease pain. Right? I don't look at it from an inflammatory standpoint. Right? There's a lot of research out there now that's saying, don't ice, cut out ice, because ice is gonna decrease the healing process. But we have to think about what ice.
That's interesting because in Chinese Eastern medicine, it's all about heat for them. They don't ever use ice
or cold.
Yeah. I was asking Dr. Elaine. I forgot what I was asking her, but I said, hey, what do you think about cold this or ice this? She's like, for us, we don't use ice. If anything, it's a lot more with heat and maybe moving the heat and the energy, right? I mean, I don't want to get off topic, but it's interesting that that's now there's research saying that ice might not be the way to go.
Yeah, well, the way I use ice is I use it for more of a neurological function, decreasing the overactivity of neurological pain signals being sent to the brain.
Got you.
And sometimes it's not even icing the area of...
Almost like a relief.
Exactly. So one of the things for my chronic patients is I ice their neck, right? They have low back pain, but I'm icing their neck. And I'm like, what the fuck are you doing? Like, I'm icing your neck because that's where the signals come in. We're trying to just decrease the way... And it works.
Yeah.
It does work. Not all the time, but it does, right? If we did research study on this, we would probably find that 50% of the people would feel better after icing their neck.
Yeah.
Right. But again, it's just a way to rethink of how to treat somebody. Right. There's more out there on how to work on treatments, right? And what we do here at Spine Health Functional Therapies is we work on, seeing the injury as what it was, right? As how it happened, right? The subjective portion of it. How did you do it? Were you picking up your kid? Were you reaching down? Were you deadlifting? Were you squatting? Every single aspect of what you tell us gives us a better picture on how to treat it, right? Because if it was weightlifting, how do we manage that with recreating load? Because if a goal for you, for example, is something to get back into weightlifting, I'm not gonna freaking have you sit there and do belly button in and out belly button exercises forever. I want to get it back to a loaded position, and sometimes it might be loaded that same day. But it really comes down to what your goals are and how the injury happened in the first place, right? So that's going to be number one for us. The second part is the assessment. How can we utilize your extremities to help your core out to be able to stabilize the area? And that comes with education. That comes with us utilizing a multidisciplinary approach, right? From DNS, dynamic neuromuscular stabilization, from functional movement systems to McGill's work, right? We try to utilize anything that we can in order to make sure that you feel better. That's the big thing. What feels better? And you should be feeling better after each visit, right? One of the things that trips me out is, when I tell my staff is, they should be feeling a little bit better every single time they're here. And if they're coming in and they're like, oh, I'm feeling worse than when I came in, guys, we're not doing our job. We need to figure this out. We need to figure out what movements are going to make them better. And that's why the assessment is so vital in our profession, right? How can we make this better? And if nothing is looking like we can help, how do we refer out? When do we take that ego out of the way, right? And we've got to push that away.
But that's key, though. You're saying assessment, because are they actually getting assessed properly?
Yes.
Right? Because, I mean, we all know if you have a low back pain, you go to your primary, the assessment is different versus what we probably do here at Shift. And absolutely. So for those of you listening, pay attention to how you're being assessed for your back injury. They might say, oh, let's go get an x-ray, but you're stagnant. You're just standing there, right? Okay, they can see, the structure, but
does that necessarily give us the prescription?
No, because what if your pain actually comes when you're moving, right?
Absolutely.
So assessment's key. If you guys aren't sure what kind of assessment we're talking about, that's what we're here for.
That's what we do.
Come out here and then let our team help you out with it.
You can even call in and we can try to figure out how and what ways we can help you out, right? We can just do a quick consultation and figure that out. Video consultation, of course, because we have to see what's going on with your movements, right? The only unfortunate thing about that is we just can't palpate. We wouldn't be able to touch and see where certain things might be overactive or underactive or hypersensitive or so on and so forth.
If you do a virtual call.
But we're trying to reach out to our local area. We're trying to reach out to the local Bay Area. But if you're not around here and you're watching this, you could still reach out to us and we can make this happen for you. What we're doing here, Ryan here is our subject, and we're just going to teach you guys some things that you guys can do at home that can simply fix whatever you guys are dealing with, whatever kind of pain. So remember, as I said, what we've talked about all day, all throughout this podcast is, acute injuries, things that kind of debilitate you, that kind of make you fall to the ground. And again, the first thing that a lot of people do is they go right for the foam roller. Now, one of the things that we were talking about with Ryan earlier today was he was saying, well, shit, should I not foam roll at all? No, that's not what we're saying. It's an acute pain. If it happens first, and if that's the first line of defense that you guys are thinking about, stop. Foam rolling is okay later on, maybe in more of a chronic stage, or maybe a little bit later, like about a week later or so, but not when it's so fresh, right? You don't want to turn something on that's so fresh. And so we're talking about injuries that you've dealt with that are debilitating, that kind of knock you on the ground. You have kids, you have family, you have friends that are all around you, and you're like, oh shit, what do I do? How can I fix this? And so Ryan here is going to act like our subject, right? Some of the things that people do first, they lay down right on the floor right away, and they're in pain, right? Act like you're in pain. So first thing that we want to do here is we want to try to get him to, get his body to relax. Right now, his knees are bent, right? A lot of the times, if he's going to start to straighten his legs out, that's probably the key that we want to do. And in this case, have his hands underneath his lower back. So go ahead and place your hands underneath your lower back. And you're going to try to do that because what the hands are going to do is going to try to create that rounding of the lower back. We're not going to try to crunch the abs at all. All we're going to try to do is just work on belly breathing. Simply put, where you breathe is not through here. It's not just through your chest, right? We have air that comes through our lungs, into our lungs, but we want to utilize our diaphragm, which is part of our core musculature. And our diaphragm is all around our rib cage area. So a couple of things that I want you to do right now is I just want you to feel the rib cage here, and I want you to bring that rib cage together. Bring it down and together. That's it. Good. And you still feel like it's pretty open in that lower back, right? Yeah. So simply put, you're going to draw the rib cage down, pull it together, and still create that lower back arch. From this point, now we're going to go ahead and bend the knees. Go ahead and bend your knees and try to continue to keep that arch in that lower back. All right, can you feel that? Yeah. You still feel an arch in that lower back. And simply put, rib cage down, belly breathe. So inhale, and I only want this to rise, not your chest here, okay? So I want you to rise through your stomach here. Inhale. Hold it, and exhale. And what we're doing right now is trying to get the core musculature to work together. Right?
So you're positioning him in the neutral spine.
That neutral spine, right? Exactly.
The natural curvature of the lower back. That's why you have his hands underneath.
Underneath the lower back.
There you go.
And that's something that you guys want to do first is try to create that neutral spine. Try to protect it as much as possible. You're going to be twisted. You're going to be turned. Some of the things that you're going to see in the mirror later on is you might be hinged a certain way. That's just your body trying to walk or move away from the injury, move away from the pain. So if you're standing like this, chances are the pain is going to be on your right side. Not all the time, but sometimes, most times. And if you're feeling pain here, you're going to probably be leaning. You're going to look at yourself in the mirror. You're going to see your rib cage is all off. You're going to see yourself torqued, twisted. That's okay, right? That's just your body trying to adapt to the pain right now. Again, what we're trying to do now is create a neutral spine in this position where he's laying down, and we're going to create movement from his core. And in this case now that we've worked on controlling the breath and seeing his belly rise and fall here, right? Now we're going to start to work on the bracing aspect, right? So step number one, make sure that you have a neutral spine and be able to breathe through your stomach. How you do that? Hands underneath your lower back, rib cage down, lumbar spine, the lower part of the spine is rounded still. Then you can bend your knees and make sure that you're still in that position here. After that happens, now we're going to work on step two, which is the bracing aspect. So rib cage down, take a big belly breath here, inhale. Now hold it, and I want you to just keep that stomach flexed. I'm going to push into your stomach here. Make sure that I can't go through your stomach. Push against it. There we go. Good. Now hold that. Now tell me what the weather looks like today. Say, is it rainy?
It's raining.
Okay, you heard his voice right there. He said it's raining. You should be able to hold a nice flexed position and still be able to breathe and talk, right? So I'm still flexing this, press. Now talk to me normal like I'm talking to you.
It's raining.
Okay, getting better. Say it's raining.
It's raining.
There we go. Now we've gotten to that point. You want to be able to get the muscles to be able to contract without you having to hold your breath. You should be able to breathe properly here. And that's just the first step. Okay, so first two things, be able to belly breathe, be able to make sure you have control over this while maintaining a neutral spine with your hands underneath your lower back with your rib cage down.
It's interesting, right? When you say bracing, some of our colleagues out there might actually feel like they should be pulling in.
Yeah,
right?
Yeah. So there's different ways of activation of the core, of core activation, right? We know from studies and research that a simple drawing in maneuver or a simple belly drawing into the lower back is activates the TVA, the transverse abdominis, the core, the obliques, the abdominal muscles, the rectus abdominis. It contracts all of those muscles when we do a simple drawing in maneuver. But in this case, I want you to use this analogy as an idea, and this is through DNS, through Kohler. think of it as a water bottle. If you take the water bottle, take all the water out of that water bottle, and you had that water bottle, the cap was open, and then you squeeze that cap, what's going to happen? That bottle is going to crumple.
Right.
Well, we look at that as like the spine and our abdominal muscles. If we take the cap on, or if we put the cap back on and we screw it on, and then we fill that thing with air and we try to squeeze it, it's a lot more stiff. And that's kind of what we're trying to create when we're creating protection of that spine, right?
Yep.
And so that's the first step. Now, if you start to feel pain just by flexing the abs, sometimes, and that's a great point, sometimes it might just need a simple drawing in maneuver so that way the muscles all around the core can start to activate a little bit.
Right. Because it's movement in and out. It's not just pull, right?
It's not just pull. Exactly. So the next thing I want you guys to do, you're going to try to flip around onto your stomach here. Now, this is going to be a McKenzie press up and how we can work on decompressing and working with the muscle spasm, okay? So this is what we're going to do. Face down for me, please. Now, here's what I want. I want you to keep your hands next to your chest like you're about to do a push-up. And I want you to place your head down on the table right here. There you go. And just relax your shoulders down. Relax all the way down. But you're just making sure that you have enough air in here. Look up a little bit more. Just your nose. There you go. You're making sure that you can have enough space for your mouth to be able to breathe here. Okay? In laying down, in this press up, we're trying to not just simply press up, but we're trying to activate the muscles that are spasming out. And a lot of the time in low back pain, the muscles down here are the ones that are spasming out. So the first thing that we're going to do is you're going to take a deep belly breath, inhale, exhale, and you're simply just going to raise your chest up. That's it. Very small, very small. Try to keep the bottom of your rib cage. See this part of your rib cage? You're going to keep that pressed down on the floor. That's it. And you're just trying to lift from your collarbone here first. That is it. Simply activating, trying to put these muscles in activation mode, using your hands to kind of help you to lift up. And when you do that, it creates a decompression into that lower back. It almost feels like you're stretching it, but you're not. You're actually contracting.
Yeah.
You're actually pulling these muscles
Interestingly enough, right? A lot of people that we see, this part of their spine don't move much.
Yeah, like the thoracic spine, right? And that's something that we need to work on mobilizations, right?
Yep.
And a lot of the time, that could be the reason why this happened in the first place, was because of lack of movement, because of lack of, or your posture was so rounded or locked up, you know? So remember, as I said, posture is more than you just standing up with a stick up your ass.
I think he's getting tired.
It's mobilization. Are you getting tired? No, you're getting tired? Okay. Good. Perfect. So
5 minutes later,
Yeah.
he's still there, bro.
he's like, do I just stay here? I'm on film. All right. So next thing we're going to do is, in order to make this a little bit harder, now we're going to work our way up the spine. So now you're going to drive your hands forward here, slightly forward, and this is stage 2, step 2. The further you bring your hands out, the higher up the back you guys are going to start to work. So as he does this, now his elbows are down. Now you're going to press up a little bit more here. Perfect. And as that changes things a little bit, right? Good. Go ahead and drop that down. And then step 3, go ahead and move back a little bit more so that way you have some more room on the table. Keep going. And then step 3, now I'm going to have his hands all the way out here. Just like that. Hands are out in front of you. And I'm just drawing up his collarbone, drawing his chin into a double chin. Push your head straight back and push into your hands. Make sure your hands are feeling the floor. Pushing down into that is going to start to activate the deep spinal muscles in here, right? And that feels a little different too from the first step, right? And now it looks like we're just doing like a, what's the stretch?
Cobra stretch.
It looks like we're just doing a cobra stretch, but in this case, we're trying to push into his elbows and his hands to try to activate the muscles.
Yeah.
Right?
Which is interesting, right? Because a lot of people, when they do Cobra stretch, all they feel is here.
Yeah, they're just jamming.
You're right.
The lumbar
Versus
spine.
you should be feeling all this muscles right here working.
Exactly. Do you feel all those muscles working right there? And you feel kind of like your neck is working as well, right? Yeah. So as you're pushing into your hands, now relax your hands. Relax your arms. Now it changes things, right? Yeah. Now that if you relax your arms and you just go into the stretch, now you're going to start straining this lower back.
Yep.
But the fact that you push into your hands, push into your elbows, and push in to the mid part of your spine here, now you'll feel all of these muscles actually start to activate and be able to lift up, right? So it's not a stretch, it's an activation technique. It's an activation technique of all these muscles in the back here. So step number 4, if you can get into this position where after you've done those extension pattern exercises, you're gonna get onto your hands and knees here. I'm simply gonna have him on his hands and knees and trying to create that neutral spine again, right? So now you're rounded up over here. I want you to try to just drop that belly down a little bit more. Drop the belly down. Now push your shoulders away, kind of like what you were doing here. Place your hands down, push, that's it, push. Nice. Good, and you're just gonna hold that position. Now we're getting into the bird dog position. Now we're getting into the positioning where the core is now starting to work. He's working against gravity. The resistance of him just doing a drawing in maneuver or a belly out position and flexing causes this to start to work, right? So the pressure of him just holding this position is actually feels pretty good. So you'll be in a protected position still. And this is one of the best ways to get you back into mobilizing yourself, to moving. And sometimes you can start getting into the bird dog position, but what I really want you guys to do for the final step is get into a tall kneeling position. One of the number one things that I tell all of my patients is get from the ground and get into a tall kneeling. Because if you get into a tall kneeling, you're just cutting the knees out from under you, which is forcing the hip stabilizers to work, which is your butt muscles, your glute muscles. And if that works, that's gonna help with decompressing the spine. That's gonna help with the core being able to do what it needs to do rather than just have to worry about holding your posture up, holding your legs, moving your legs, moving your feet. So next thing I want you to do is get into a tall kneeling position here.
Good.
Can we see that? Is that okay?
Yeah, we can see it on his camera.
Okay. So in a tall kneeling position, as he's here, right, all I want him to do is just sit, kneel, squeeze your butt muscles here. That's it. Simple squeezing of the butt muscles. And if you could do that and you could just try to hold yourself up, that's going to be the final way that I want you guys all to work on getting yourself mobile again. One thing that I had done in the past was I was deadlifting and I felt that snap, I felt that pop. And I was at the gym and I remember falling directly on my knees and I just sat there. I just knelt down and I remember people walking by and going, "You okay?
Right.
What are you doing?" And I was like, "I'm fine." But I knelt there for about 10 to 15 minutes. And I stayed there for a long time. After doing that, because I was just waiting for everything to calm down a little bit, I got up, I was able to take the weights off, I was able to put the weights back, and then I was able to drive all the way home. I went back into my house and I knelt down for another 10 minutes.
Yeah.
But then the next day I was perfectly fine.
Yeah.
Right? So again, this is only to get, these tips are only to get you guys mobile again, get you guys to where you guys need to be. If you guys are in the gym and you guys hurt yourself, you don't have to call an ambulance. You could just go right into this position first, right? Get into a position where you can work on trying to get the muscle to relax. And in that way, it's not a massage, not foam rolling, not stretching. It's trying to get other things to activate for you.
Right.
Okay?
That tall kneeling I've done it before with clients too. It totally releases any stress in the lower back.
Yeah, absolutely.
Yeah,
and they've added this with Egoscue in the past, right? That's something that you've worked on before in some of your history. And that's, with the temple breathing.
Right, with the elbow touches. And
that's going to be, that'll be for another
We'll touch upon
talk.
that,
another talk
they have
later on.
They have some pretty cool approaches too.
Exactly, and that's, his approach is with Egoscue has actually helped me with a few of my my spasms as well.
Yeah,
so in
absolutely.
the past. So that's kind of got me back from Chicago, right?
Yep.
So you're good here. You're all set. Go ahead and lay down.
How you feel?
So you're not nice and not in tall kneeling. You could stay. You could pose that way if you want to.
The sexy pose time on the side. There it is. There it is. All right, folks. Hopefully, all that information for those of you guys that experience back pain or just not knowing what to do. Hopefully you enjoyed all that information, all that piece on the lower back approach from our perspective. Dr. Joe here can wrap up again.
So there's 5 tips that we gave you guys. Utilize those 5 tips just to get you guys back in here, just to get you guys moving, to get you guys to where you guys need to be, which is number 1 in this office. To get you guys back to mobile, making sure that the pain is gone, but making sure that the pain doesn't come back.
That's right.
We're here for you guys. You guys can call us, 415 347-7380. We're here at Shift in Daly City.
Daly City.
We're here to help you guys out. Let's get you guys back and
Hey.
moving better.
Let's move better.
Move better, you guys.